Cervical cancer is the cancer of the mouth of the uterus, the area which is called the cervix. Hi, I'm Dr. Kanika Batra Modi and I'm a gynae surgeon. I'm a senior consultant in the Department of Oncology at Max Hospital, Saket. Cervical cancer is the third most common cancer in India in women and the second leading cause of death. The age distribution is bimodal, one occurring between the age of 40 to 45 and the other after the age of 60. So what are the symptoms of cervical cancer? Well, mostly it is asymptomatic in the early stages, but an abnormal bleeding pattern, which is basically an intermenstrual bleeding or a post-menopausal bleeding in a woman who is menopausal, are the most common symptoms of cervical cancer. The other symptoms could be abnormal discharge, a foul-smelling discharge, or when the cases are advanced, back pain, lower pelvic symptoms, a dragging pain in the lower pelvis, or if it is metastatic, whichever organ it is involving, those kind of symptoms can be caused. Well, is there a test which can prevent cervical cancer? Well, not just a test, we even have the vaccines now which can prevent cervical cancer. A very simple test, pap smear and HPV testing. HPV basically is human papilloma virus testing. These testings, they start from the age of 21 years and they go on till 65 years. This simple test can detect precancerous lesions in the cervix, of which if the woman takes treatment, there is a very high chance that the development of cervical cancer does not occur. These simple tests and their management, if any abnormality comes, can prevent the development of cervical cancer. So what is the treatment option available if cervical cancer has been detected? Well, if detected in the early stages, the treatment is primarily surgery. And if detected in the later stages, then radiation therapy along with some form of chemotherapy is the primary mainstay of treatment. And we have these varied treatment options which are available, which help us manage cervical cancer in a very good way. So cervical cancer is basically the cancer of the lower part of the uterus, and we have a vaccine, HPV vaccine, which is available, and a very effective 9-valent vaccine has now been made available in India. We should take use of it. Apart from that, we have a very effective screening test, which is pap smear and HPV testing, which can further prevent development of cervical cancer by treating those precancerous lesions. So overall, cervical cancer, the incidence is reducing, and we can reduce it further by being vigilant, by getting our screening testing done, and being aware of HPV vaccine. Thank you for listening. I hope you found the video informative. If you have any questions or queries, please feel free to put in the drop box below or comment in the section below. Thank you.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.